Okay, ma'am.
List of folders.
Hello?
Hello, sir. Can
Ah.
you hear me?
Yes, yes. I can hear you, madam.
Yes.
Okay. Good morning to all. Today we are going to have a guest lecture on the occasion of World Kidney Day, and some of you are attended the rally also. So we have a guest lecturer, Mrs. Renuka Bhagewadi. Madam is an alumni of our college. Madam has completed BSc Nursing in 2005 from our institute only. And after that, Madam has completed master's degree, MSc Nursing in Medical Surgical Nursing specialty in 2012 from Rajiv Gandhi University. And Madam has studied in Keli Nursing College, Hubli, master degree. And presently, Madam is working as an assistant professor in SDM College of Nursing. Okay. And today, Madam is going to uh, give a guest lecture on World Kidney Day. That is on the theme of World Kidney Day. That is kidney health for all, preparing for unexpected and supporting the vulnerable. Madam, over to you. You can start.
Good morning, dear students. So today we will discuss regarding World Kidney Day. So can you share the PPT? Or I can just operate it.
Madam, you can share the PPT.
Okay, sir.
Full
Good
screen.
morning, students. I hope I can reach everybody at the last corner who is sitting also can hear me. I'm very glad to see the strength of the class. I hope nobody will sleep now. So as sir told me, myself Renuka Bhagewadi, assistant professor. So today we'll see regarding World Kidney Day. So every year this day is celebrated as World Kidney Day, and this year theme it is Kidney Health for All, preparing for the unexpected, supporting the vulnerable. So World Kidney Day is an annual global event marked on 9th March every year that aims and focuses to raise the awareness about Kidney Day, and it mainly reduces the global health diseases of the kidney. Okay, so this World Kidney Day 2023, the theme already I have declared that preparing the unexpected and supporting the vulnerable. It means emphasizes the importance and the kidney diseases for early detection and effective management and care. Now, I hope you people are visiting dialysis ward. I hope you people are going through the kidney diseases patient. Nowadays, you can see every 1 in 10 population among the people, 1 in 10 strength is every single individual among 10 people are vulnerable for kidney diseases. So here our kidneys are true champions when it comes to multitasking. Our kidneys constantly working to maintain our well-being and keep us feeling our best. This shows our little powerhouses. We have to encourage it with the World Kidney Day program. Okay, so as I've already told, millions of the people are suffering from the kidney day. Mainly 1 in 10 people suffers from kidney disease. So there are mainly, I hope you people have learned the functions of the kidney. Okay, so I'll just make a review of it. So it filters the toxins and waste from the blood, controls the fluid levels in the blood. It releases the blood pressure, regulating hormone, maintains strong bones by activating vitamin D. It releases the hormone that controls red blood cells formation and maintain blood mineral balance, that is sodium, phosphorus and potassium. There are many other activities which the kidney also does. I've taken the main things. So what are the problems caused by kidney diseases? So mainly the main problems are with the heart attack and stroke and high blood pressure. Always remember students, whenever a kidney is in problem, the main problems are with diabetes and blood pressure. These are the two main positive things which will damage the kidney, and plus obesity also. So here the other things are the put the life at risk, weak bones, the heart diseases, kidney failure, that is end stage renal disease, that is the fifth stage of the renal failure, and nerve damage, that is neuropathy, and anemia or low blood cells count. As you people know, the function of the kidney is with the production of RBCs. Okay, so here, what are the troubles or what are the problems when kidney diseases are occurred? Okay, here there are only few points which I have mentioned. That is pink or dark urine, that is blood in the urine, difficult or a painful urination, increased need to urinate, increased thirst, fatigue, weakness, swollen hands, face, feet, abdomen, ankles, puffy eyes, and foamy urine. I hope you, when you enter into the wards, okay, so in the dialysis, you can see them, the clear picture you can directly see on the patients. So the look of the patients will be like the same features what I have written here. The puffy face, swollen hands and feet, abdomen, ascites, okay. So you can see the peculiar changes in the CKD patients. That is also especially the fifth stage, that is what end stage renal disease. Okay, so these are the features when you want to find out or when you come to know that there is a CKD patients. Okay, so you should know the simple things, that is life saving test for kidney diseases. So what are these? Especially when you go near the patient, I hope you people understand it is the importance of blood pressure and the blood sugar level and urine test, all these things, how much importance for kidney people or the kidney diseases people. Okay, first is with the blood pressure. Okay, so you have to teach the patient to get checked the blood pressure level every weekend. Okay, so weekly, thrice a day, if the patient is with the CKD diseases, he has to monitor his BP. Okay, so the thing is, he has to monitor, that is, the reading should be below 130. Okay, and if it is 120, it will be the best. So next is with the first test is with the monitoring of the BP. Then second is with the protein in the urine. This is the second test, that is the urine test which you will do for albuminuria. Okay, when the kidney is failing to do its job. Okay, then you can see the traces of presence. Okay, so you can see the presence of albumin in the urine. Okay, albumin in the urine and the protein. So if the normal level between the or below the 30 mg, so that we consider as a normal. If it goes above, then you can consider it as very high end. Okay, then the third test is with the glomerular filtration rate. I hope you have studied in your anatomy classes and physiology classes the structure and the function of the kidneys. Okay, no, I suppose I'm not going to tell regarding the detail of it. So GFR rate will be done with the blood test. Okay, so you have to consider this GFR rate. If it is 90, it is good. Okay, if it is monitored like a score less than 60 for 3 months, then it shows that renal dysfunction. Okay, so these are the three main tests you have to concentrate. Then other than that, there are other several diseases, the blood test, which you can do for checking of anemia because the patient will become anemic. That is the routine blood test. Okay. Then other examinations. Okay. So people existing with a high blood pressure and diabetes should manage their condition through medications and lifestyles. That is the only thing that they can do. So why we are concentrating on this because early detection involves screening, especially we can prevent the future diseases or future protection from the complications. That is why we are mainly concentrating today at the kidney diseases people to detect early and find out what is the intervention we can give to them and slow down or prevent the future prognosis for the diseases. That is why we are stressing more on the World Kidney Day with this condition. So what is this living well with the kidney means? The thing is, whenever we come across the kidney diseases, if we heard this kidney problems or the person has got CKD or AKD, that is what the acute or a chronic, it will be like terrific to the patient that patient will be feeling like, okay, life is end. Here is everything went off, or he may feel like there is a end point to the life. That is what he thinks. But the thing you should understand, he should cover up with the life, or he will come again or overcome with the problems, so that this World Kidney Day stresses on this. So you can see the PPT. Kidney disease does not have any or it does not have to define your life with a good care and treatment. You can be growing and live your best. So this is what I have written here. Living with kidney related disorders will be challenging, but with the right care and support, people can live full and productive lives. This is what the patient needs. Okay, with the healthy diet, lifestyle, and all the treatment and the support, patient can live for the longer time along with the dialysis. I hope you people know the treatment of CKD. Either it will be with the dialysis and with the transplantation. That is what the present scenario you can see. Many of the kidney transplantations are going on around the world, because nowadays it is very common that is what I've told you people. 1 in 10 people, it is the commonest thing what is there now at present. Now, some of the strategies, as I've already told you people, what are these? Okay. So first thing is what? Following the kidney friendly diet. So that is sodium, limits to the sodium, potassium, and includes adequate proteins, carb. Then other things like regularly engaging in the physical activities, taking medications as prescribed. Now the thing you have to remember, CKD patients are mainly pre-causes, or you have to find out the family history, whether they had any diabetes in the family or a blood pressure. So you have to find out what is the main background. So after finding out, you have to see for other disease condition. Then if they are like suggested by the doctors with the NSAIDs, that is what non-steroidal anti-inflammatory drugs. So these are one of the main cause for kidney problems. NSAIDs are with the main problems, that is what the cause for kidney diseases. So you have to tell the patients to avoid NSAIDs. So many times we have observed that mainly the people like above 60, if they feel like they have pain or something, they start with the NSAIDs without prescriptions. So nowadays we should not encourage for such things. So you have to guide the patients in a right pathway so that we can prevent the kidney diseases. Then staying informed about the diseases and management through education and support groups. Then managing stress through the techniques like meditation and counseling. This is the main thing where, because the main problem is with the obesity, diabetes, and the hypertension. Okay, for all the things, the managing the stress, relieving from the stress, it is the main cause. So if we manage this, then you can prevent the many of the problems which can damage the brain. So that is what the thing is. So meditation and yoga is must for the people with the kidney diseases, and you can encourage them by counseling. Getting enough sleep and avoiding tobacco and limiting alcohol intake. So you can find out like many of the times, whenever I hope you people will go and ask the history to the patient, then he will be like, I am an alcohol addict, if he says. So you cannot suddenly stop, you cannot tell him quit alcohol tomorrow. It is highly impossible for the person that if he is a regular consumer, he cannot quit at once. You have to taper the things. you have to advise him that limit the alcohol intake. If he is drinking 3 or 4 glasses, that is 60 ml or 90 ml, whatever the dose that he will take of alcohol. So you have to tell him reduce the amount day by day, and then he can limit the alcohol intake daily. So that is how gradual decrease of alcohol intake you have to advise him. Then later he will only quit when he comes to know the side effect of it. Okay, so that is how you can give a education regarding the things. Then maintaining a social connection and engaging in activities that promote mental health and emotional well-being. See students, this is the main point which I want to concentrate, because and when I was in Belgium, Kelly, see, we had to go to dialysis ward when we were BSc. Okay, we were like, that is not the thing. Like in that age, we are that matured. So whenever we used to go, we used to not understand the pain of the patient. We used to just go, check their BP, check their weight. We used to just see and talk to them and then come out. Okay, then we really sat to study what is CKD and all. Then we connected the material of the theory along with the patient. Then we realized what all complication patient may feel. So you have to, whenever you are going to the dialysis, I want you people to please interact with the patient, because psychologically patient needs the support of the staffs and the students who are present there, because they will feel lonely first of all, because they feel neglected, because they have a CKD or many of the problems with the health issues. So they feel like next moment I'm not on the earth. That is what their feeling, gut feeling will be there. So your support and mental attention is needed for each one present over there for dialysis and with a kidney transplant patient. Okay, so this is emotional well-being is the main point. You have to connect with the patient. This is what the main point I want to stress upon. Okay, so what you need for a healthy pair of kidneys means healthy body and healthy life. Okay, so you can take a moment to appreciate the work which is done by the kidneys today. So they are like, whenever we see, we feel like nurses are the heroes during the COVID and all. But in our body, kidneys are the unseen heroes. That is what it does many of the things and we are unaware. But they deserve the care from us. That is what the thing, healthy pair of the kidneys. It is our born duty to take care of the kidneys, and it is our born duty to educate the people regarding the health conditions of the kidney and how to protect it and how to prevent from the diseases. And you can just share your knowledge with your patients so that they will be prognosis will be sure for them, and it will be cured for many of the disease conditions. And now at present, whenever you are going to the ward, you will take care of the patients with the diabetes and hypertension to prevent from further disease or the worsening of the condition, to avoid CKD patients. Okay, that is what the thing is. This was my topic. Okay, so come across. Any questions from your side? Raju sir?
Yeah, thank you, ma'am, for the valuable words and sharing such a good knowledge. I hope the students will make use of this knowledge in doing the daily activities of hospital clinical settings. Thank you, ma'am.
Yes, sir. Any questions, sir, from the student side?
Any questions? Any doubts you have?
Give the mic to any of the students, sir. I just want to interact with them.
Yeah, ma'am.
Good morning, ma'am.
Good morning, dear. Did you see the slides? It was clear.
Yes, ma'am.
Can you hear my voice audible?
Yes, ma'am.
Okay. Did you understand the content?
Yes, ma'am.
Can you tell me the theme?
Ma'am, to protect
Yes.
the living and the vulnerable people, to provide the message.
Okay. It is. The theme is health, kidney health for all. Okay. So it is the prepare for the prepare the student, prepare the people for the unexpected and the vulnerable disease. That is what the thing is. I hope you have understood the topic, Ray.
Yes, ma'am.
Okay. Any questions? Other students? Thank you.
Thank you, ma'am.
Thank you, Ray.
Thank you, ma'am.
Okay, sir. I can keep the things up or anything.
No, ma'am, it's done.
Okay, sir. Thank you, students, and thank you, sir.
Thank
And
you.
thank you, management, for giving me the opportunity to take a guest lecture on this. Thank you, sir.